Okay, so today we're going to talk about chickenpox. And if you ever noticed on your immunization records, it might say you got a varicella vaccine. This is basically for chickenpox. And this is actually a relatively new vaccine. I don't remember exactly how long, but before I started teaching, when I started teaching, the vaccine hadn't been developed yet. So, and I've been teaching 20 years, so it's not that old of a vaccine. So let's talk about chickenpox. First of all, what do we know about chickenpox? It is a mild childhood disease. Okay, it's a mild childhood disease, and it has a low death rate. Okay? If death does occur, it's usually due to encephalitis. And encephalitis is inflammation of the brain. So what happens is the virus goes to the brain, your immune system attacks it, causes inflammation, and it kills you. When death does occur, it occurs from encephalitis. Okay? And then people don't know this about chickenpox, but chickenpox is actually a form herpes. Okay, everybody always hears about herpes, but what they don't know is that chickenpox is actually a form of herpes. It was caused by herpes, by a herpes virus. Okay, and the name of the virus is Varicella zoster. That's a Z. Okay, which is also known as herpes virus 3. Okay, so that's some of the things on so far. It's caused by a form of herpes, which we'll be talking about: herpes 1, herpes 2, herpes 3. Herpes 4 was Epstein-Barr virus. Herpes 5 was cytomegalovirus. Herpes 6 and 7 are still coming up. So let's go on. Okay, and so what happens in chickenpox? Basically what happens is you get vesicles, which are like blisters, that fill with pus. And remember, we saw this also with smallpox and monkeypox. Okay, fill with pus. Then what's going to happen is these will burst open. And then form a scab before healing. Now, the thing about this is sometimes people will actually, because it's a very itchy disease, people used to scratch this. And so it would actually leave scars. That's what my other video was about, that I sent through Remind. Okay. How do you get it? You get it through the respiratory route. In other words, you get it by breathing it in. So someone else has it, and then you breathe it in, and then what happens is you get it. Okay? And it's better to get this as a kid than it is as an adult. Where do you get the vesicles at? So the vesicles usually occur That's a CL right here. Let me go like this. Vesicles occur on the face, the throat, and the trunk, which is your chest area and back. Okay, so that's usually where you're going to get the vesicles. Now, here's the interesting thing about this, is after it goes away, after the infection goes away, the virus goes and hides in a dorsal root ganglion. Now, a dorsal root ganglion, I'm going to draw it in just a second, but what happens with a dorsal root ganglion is when you have the nerves coming out from your spine, the cell bodies from those nerves are all together, and it creates an enlargement in the nerve. And that enlargement is called the dorsal root ganglion. The reason they call it dorsal root ganglion is because of the fact that it's in the back. Okay? And then it becomes latent. What that means is it's inactive. It just goes and hides there. It's like a hideout. Okay, so it becomes latent. Now the reason it does this, 1 second. So if we go like this, if I was looking at my spine, this was looking at my spinal cord from the top down. You actually have nerves that come out from the back. This would be the back. This is going to be the front. All right, and then you got the dorsal root ganglion. I'm just going to put DRG for dorsal root ganglion. These are cell bodies. So you have your nerve cell bodies here, but they have extensions. If you've ever seen a nerve, you've probably seen it look something like this. It has pieces that stick out, and it looks like that. This would be the cell body right here. Okay, so the cell body is going to be right in here. All right, and then this comes like this, and it goes out to the body. And then you also have your anterior root, which has nothing to do right now. So this is where they're going to hide, is in this area here. That's called the dorsal root ganglion. Okay, that round circle, by the way, was your spinal cord, if I didn't mention it. So now, while the virus, the reason it stays there is because while the virus is in the dorsal root ganglion, your body's white blood cells can't get to it. I'm going to trade pens here. Cannot get to it. So it just stays there. And this is going to become important later on. All right. And because the white blood cells cannot get to it, there is no immune response. There's no immune response. Okay? Now, here's the thing is you guys all got a vaccine for this, okay? But the vaccine for varicella, for chickenpox, decreases in effectiveness over time. So basically, you have to get the shot again. People always think that once you get a vaccine, you don't need it again the rest of your life, but that's not true. Okay? Now, the bad thing is, this may lead to more cases of adult chickenpox. And adult chickenpox is brutal. With adult chickenpox, on a kid, you usually just get it on the face and the trunk, like I said. With adult chickenpox, what happens is it can get in the eye, on the eyelids, it can get in the throat, it can get in the ears. My sister-in-law never had chickenpox, and her daughter got it. And I told my sister-in-law, do not go anywhere near her because you've had it. And she goes, well, that's too late. Or you haven't had it. And she goes, that's too late. The chickenpox hit her so bad that she actually had to stay in the hospital for like 5 days. It almost killed her. Okay, so that's it right now. That's part 2 of chickenpox. So in the next one, we're going to be talking about part 3 of chickenpox.